Hi, my name is Laura Ricks. I'm in NURS 3320, and today we are going to be doing a lung and respiratory assessment. So I would like to say that this isn't exactly how you're going to do it in real life, where you're going to be going through each point. So a lot of this will be more streamlined in the real world. Come into the room, washing my hands, identifying my patient, make sure you provide privacy. Those are all the general basic stuff we're going to do in the beginning. And then I'm going to explain, after I identify them, what we're going to be doing today. So today we are going to do a lung and upper respiratory system assessment. Is that all right with you? We're going to be listening and doing some other physical assessments.
Yes.
Okay, good. First thing we're going to be doing, and a lot of times you'll be doing this while you're having that initial conversation, is you're going to be looking at their facial expression, or if they're grimacing, or doing other things. A lot of times we'd like to just see very neutral, calm face. And then you're looking at their posture, if they're sitting hunched over, if they're in that tripod position, if they're guarding one side or the other. Tripod is very common with our COPD patients. We're looking at their colorization. And that's, we're not looking at the melanin of their skin color, we're just looking at the underlying tone. If there is a bluish tone, we're looking more about cyanosis. If we're looking see a white or a light gray, we're seeing more of a oxygenation issue with anemia. And then also like a red or purple, we're thinking we see that very commonly with smokers. And then we're also just going to look at the general work of breathing. Like this is a very just kind of quick, are they breathing very deeply? Are they having to do a lot of extra work to breathe? And it's very easy to see that when you just kind of walk in without doing a full assessment. And he's good. All of those, we're all checking all the normal boxes. And then after that, we're going to palpate the chest wall and do kind of a general examination there. So we're checking for symmetry and muscle tone, which his is appropriate for his age. And then we are looking at the costal ankle, which starts from the base of the sternum and goes off to that last rib, and we're just kind of palpating and finding that. Generally on both sides, it's a 45-degree angle, and then it gives us a total of 90. We like it 90 or less. We're looking for that anterior-posterior ratio compared to the transverse diameter. And normally it's 1 to 2. 1 to 1, we're seeing more of that barrel chest with our COPD patients. And then we're going to do a little more focused examination of the chest wall. We're going to take our fingertips and kind of go across. We're going to feel for symmetry. Are you feeling any tenderness, any bulging? And also just again checking for symmetry. You can do that both anteriorly and posteriorly. We're also going to look at his chest wall expansion. So I take both my hands like this and hold it on both sides of his chest, and I'm going to be watching how my thumbs come up and down. And we're just checking for evenness. And uneven chest expansion is more indicative of, it can happen with other lumbar issues where there's scoliosis and different things. But it can also be indicative of a collapsed lung. You're going to do that both anteriorly and posteriorly. And then we're just looking at his color. We're going to be looking at his lips and their gums to see if they're blue or cyanotic, and then we're going to look at their hands. We're checking their cap refill, which we like it to be less than 3, greater than 3 we're looking at. Perfusion issues. We're looking for clubbing of the fingernails, which we do not have here, which is good. Besides looking at the general work of breathing, we also want to check the rate of respiration. It should be between 12 and 20. Don't tell them when you're doing this because they will change how they breathe. So anything less than 10 is bradypnea. Anything greater than 24 is tachypnea. We're looking at the rate of which they're breathing, the rhythm of which they're breathing. We're looking at the depth of their breaths, and we're also paying attention to what muscles they're using while they're breathing. We would like to see the diaphragm and the external thoracic muscles being used more prominently. We don't want to see the chest muscles being used for breaths. So that's good. That's what he's using. We're using our diaphragm. And then also we're just going to take a quick listen to him. There's 3 different areas that we listen to for specifically. We're going to listen for the bronchial breath sounds up near the trachea and just kind of move in a very systematic left to right compare. This is where we're going to hear those high pitched sounds and have them take deep breaths as we're doing this. We're going to hear those high pitched bronchial noises. You can stop taking deep breaths. I don't want to make you hyperoxygenate yourself. And then the vesicular bronchial breath sounds are on both sides of the sternum, and we're going to be listening there, and we'll hear those medium, mid kind of pitched sound noises. So left and right, a couple there. And then we're going to be listening for the vesicular breath sounds on both sides, up and down, and you'll just kind of work in a very systematic way, up and down. And then we'll do that on the back as well. Any crackles, stridor, those are all low sounds too. I don't know if I said that. The vesicular ones are all low sounds. Any stridor, any wheezing, any bronchi, any crackles, any diminished breath sounds, we make sure I want to report that because will be indicative of different issues. And besides looking at our SpO2 and our jugular, which we want it to be midline, a deviation is indicative of different issues. And besides doing our general other assessments and looking at their level of consciousness, he's been quite cooperative today. Thank you for that. And do you know where you are? Yeah, okay. So that's about it. We're gonna do some hand hygiene and then do some charting, and that's it.